Hi, everybody, and welcome. I'm going to be presenting to you today how to use the DTS and bCAM as delirium screening in the rapid intake in EPIC. So this tool was designed to be used for anyone that's 65 years or older. Also, one of the foundational pillars of this project and introducing the screening tool is to make sure that we are respecting your time. We want to make sure that this is not taking up too much of your time. This is a screening tool that we have to introduce. So we wanted to approach it in a way that's going to be easiest for you guys. So just as an example, I'm going to navigate to Santa Claus right here. He's a 55-year-old male. And notice that in his rapid intake, when we navigate to the screenings, the DTS and bCAM is not in here because he's less than 65 years old. Now, if I go to our delirious patient here, who is a 74-year-old, notice that in the rapid intake, we have the DTS and bCAM. So it's designed for you to complete the screening tool as you are doing your triage. If we go to the DTS and bCAM here, and I click on a new reading, it's going to prompt me to start with the DTS. So it gives some background. The DTS and bCAM are two different screening tools combined into one. So you do not have to do the bCAM if the DTS determines there's no delirium. Again, trying to respect your guys' time, right? So the first thing that pops up in the DTS is the RAS. If you're not familiar with the RAS, the description of terms does a really good job of describing what each thing here means. Most of our patients are going to be alert and calm. There is a subset of that population, about 25% of those that are 65 years or older, that are potentially delirious, and we're missing it. And it's very often the hypoactive delirium. But for the purpose of this demonstration, let's say that this patient is alert and calm, no concern for delirium. And then it's going to prompt you to ask this question here. This is the second part of the DTS, to ask the patient to spell the word lunch backwards. So let's say the patient says HCNUL. So they get it perfectly correct, less than or equal to 1 error. You click that. And then in nice green here, it tells you that DTS score has determined negative for delirium, no delirium. You are done with your screening. It's that easy. Two quick clicks. One of them is an assessment type question. The other one is something you have to ask the patient. For the purpose of the demonstration, let's go back and let's say that this patient is maybe a little drowsy. That's the hypoactive one that we're very often missing. The patient is a little drowsy. Look, it does not prompt you to ask the question about lunch, spelling the word lunch backwards. It goes directly into determining that, hey, this is positive because the patient's a little drowsy. So that means that there's a likelihood of delirium. You have to continue to the bCAM. So it prompts you right away to start the bCAM here. bCAM is composed of 4 features. This is feature number 1. You assess the patient altered mental status or fluctuating course. Does the patient have this or no? Let's say the patient does not have this. They're drowsy, but they're not altered. I hit no, bam, you're done. You do not have to do the other features because this has determined that the patient has no delirium. But let's say that the patient is a little altered. The next question is going to be asking the patient to list the months backwards from December to July. So December, November, October, September, August, July. Let's say the patient gets that all correct, less than or equal to 1 error. Done. This determined that there is no delirium. The patient did great on that. Now, if the patient gets more than 1 error, again, we're moving on to feature 3 here. The nice thing about feature 3, it's the RAS again. So we, again, built this tool with your time in mind. So we took the RAS score that we did in DTS just a few seconds ago and transferred it over here. So that way, you do not have to reassess this because you just literally did this. So now if the RAS is obviously the same as it was before, this tool is going to tell you that you have positive delirium. So, and then that tool is done. You get this yellow bar here that tells you patient screen positive, notify provider, and you acknowledge that you have notified the provider. Or there's a no box here. You can click that and give a comment of why you did not notify the provider. Now, let's say for some reason you did get a -1 drowsy here, but here you're going to click that because all of a sudden the patient's alert and calm. Well, now you're going to do feature number 4. This is the last one. And this unlikely you're going to have to do this because if you got to this point, it transferred your RAS down here already. But if for some reason you get to this part, this is going to ask you to ask the patient these questions here. Will a stone float on water? Are there fish in the sea? Does 1 pound weigh more than 2 pounds, etc.? Questions like questions that a delirious patient would have a really hard time answering. So let's say the patient says no errors, then negative for delirium. But if he has at least or she has at least 1 error, positive delirium, continue to notify the provider. You have to hit this acknowledge button. The screening is not complete until you acknowledge that you did communicate to the provider. So this is the delirium screening in a nutshell. Again, one of the things that we are truly focusing on is we have to introduce the screening in accordance with our geriatric emergency department accreditation. and we want to make sure that it is as simple, as easy, and respecting of tool as much as possible. So if you have any questions, please reach out to me, and otherwise I hope this goes great.